Ranjan.
Hi.
Just have a quick question. I know the holiday season are wrapping up, and I know suicide and depression tend to be on the rise during this time.
Yes.
What can I do for a family member that I think might be in need?
Yeah. That's not uncommon. In this holiday season, a lot of people get rather sad. And the sadness could range anywhere from what we call, holiday blues to full-blown depression. And if somebody is suicidal, obviously, the family needs to intervene. The best thing to do initially is to engage the person in conversation where you can make sure that person feels supported. And then secondly, you need to take the person to a mental health care provider as soon as possible. The best place to take them would be perhaps an emergency room, because if they're suicidal and you do not know if they have a plan or you do not know the seriousness of their suicidal ideation, then you do not want to take any chances with that. You want to make sure that person gets in care as soon as possible. So those are the two main things you can do. Actually, three main things: engage, be supportive, and take them to the nearest emergency room.
Now, if they are diagnosed with depression and it's bordering on suicide, are there any treatments out there? Are there things that medications or any sort of therapies that have been found effective?
Sure. Depression is quite treatable. Actually, depression is more treatable than many other medical or quote-unquote physical conditions. So, of course, the medications are the mainstay of treatment for depression. And we have so many options these days. We have, close to 30 medications for depression on the market. Now, the counseling works very well, especially the cognitive behavioral therapy is known as CBT. Other kinds of counseling might work too. So the medications and the counseling, I think to round it up, I think the lifestyle changes and some measures to reduce stress in one's life, all those kinds combined can really provide for a great treatment for depression.
Now, what are some signs that changes in the person's behavior or types of lifestyle changes that might signal that a person is slipping into depression?
Well, the number one, the most crucial symptom of what we call major depression is, of course, going to be either depressed mood or significantly diminished interest in pleasurable activities. And then also what you typically see is that there is a departure in their behavior from the usual daily routines. For example, some of the daily functions such as sleep, appetite, or interest in sex, those you see disturbances of those functions. You also might see feelings of hopelessness, helplessness, worthlessness, a profound sense of loss, especially in the context of any recent event that may have occurred. If you see some other indirect signs, such as if somebody starts talking in a way that alludes to the fact that they may not be here in near future, or if somebody, let's say, starts to give away his or her belongings, suddenly, those are really very, very serious signs that you need to take that person immediately to the care of a mental health professional.
Well, thank you, Dr. Ranjan. I really appreciate your time.
Thank you. I hope it was helpful.
Have a great day.
You too.